right, everybody. Welcome to Better Utah Broadcast. My name is Katie Matheson. I'm the Communications Director here for Alliance for a Better Utah. Remember, we go live every Wednesday at 12:30 talking with the different movers and shakers in Utah. Next week, we're going to have, that's what we call you, movers and shakers. Next week, we're going to have a legislative review because even though it's the day before the end of the legislative session and who knows what will happen on the last day, we're still going to be reviewing the legislative session next week. So be sure to click get reminder when you see that we're going live, et cetera, et cetera. So, and Chase just walked in. So today we have Stacy with, not Alliance for Better Utah, UHPP, Utah Health Public Policy. And then we have Catherine from Mormon Women for Ethical Government. So we're going to be covering kind of a broad array of issues here today. So if you guys could give us a little bit of a background on your stories. So Stacy, what got you involved with UHPP and what does UHPP do? Give us that kind of stuff.
Yeah, I started with UHPP 5 years ago, almost to the day, as an advocate, as somebody who needed health care. So 6-7 years ago at this point, I was in a car accident, lost my job, lost my health insurance right as I was getting sicker. So I found myself needing health care and right when I didn't have access to it. So I started volunteering and sharing my story and got kind of nerdy about the policy, and over the years I've become kind of the policy expert too, and am now working with UHPP as their policy analyst. So I have an interesting perspective of that consumer focus where I've been there, done that, now I want to make widespread changes.
Nice. And so UHPP, what is nonprofit, right?
Yeah, nonprofit, nonpartisan. Just a really broad approach to healthcare where we want healthcare solutions and we work for it through education, through legislative work, through grassroots, on the ground efforts. Just taking a little, a wide lens approach at how to fix healthcare.
Cool. And Catherine, tell me a little bit about yourself, Mormon Women for Ethical Government. What are you guys about? How did you come to be? All that kind of stuff.
Well, Mormon Women for Ethical Government began about a year ago, January 17th, I believe, 2017. And it grew out of a small group of women who felt like they wanted to participate more in our government and in the workings of the country, because they felt like there were things happening that they had not been involved in before, and this was a time to step up. It started out as a very small group of women, but quickly grew to 3,000, and now we are at nearly 6,000 members. Here in Utah, we have about 660 members. So it's really exciting. I'm your average Mormon suburban mom. I've always been interested in social issues and in government issues, but I've been preoccupied with my own concerns for a long time, and I finally felt like it was time for me to get more involved in preparing for the future, for my children's future, and for the futures of our community as well.
Wow, yeah. That's some great stuff. I was going to have a good comment, and I don't remember what it was, so good for MWEG. So now I have a very important opener, and viewer, please feel free to give your opinion, but I need to know, do you pronounce it GIF or GIF? The way that you answer this question will determine how this interview goes.
I have very strong opinions about this. It is absolutely GIF with the hard G.
Oh my God, no. Wrong.
Absolutely.
Wrong.
Thank you. Graphical. It is the first abbreviation.
But that's not a law. That's not
GIF.
a rule.
How do you pronounce it, GIF? That just sounds like peanut butter. No, I have strong opinions.
Yeah, that's where it came from. Do you know what we're talking about?
I do. I'm not as old as you might think I am, but
I assumed when you gave over the mic, you were hoping to see what she was going to say first.
I just wanted to share. No, but I remember back in the dark ages, it was a GIF. It has been a GIF forever.
It's so terrible being surrounded by so many wrong people. All my coworkers also disagree with me. So,
okay.
Except for Brittany, who switched over to my side, but now, yeah, she's just kind of going with the flow. Okay, fine. All right, so let's get into real stuff, serious stuff. So, Stacey, let's talk about healthcare. So we have a little over a week left in the legislative session.
Yeah.
Stuff is getting real, right? All the intense bills are coming out. So yesterday we finally saw for the first time Spend Love's Medicaid expansion bill. And so people have been talking about it, not quite sure what it would look like. And so for Alliance for a Better Utah, this is something that's caught our attention because we believe it is an attempt to directly undercut the ballot initiative, which is trying to get full Medicaid expansion, which I believe is for people up to 130% of the poverty level.
38, yeah.
Okay, and so this bill, my understanding is that it would be for 95% of the poverty, people who are at 95% of the poverty level.
Yeah.
So is UHPP looking at this at all? What are you guys' thoughts on it?
We are. We're looking at this because we want Medicaid expansion. We want Medicaid expansion for as many people as possible. And we're concerned about this for a lot of reasons because it doesn't do that. It's not a full expansion, first of all, because it's up to 95%, like you said, but there's a big asterisk there because there's also the ability to implement caps at some unknown level. So we don't even know where that cap will be because it says in the bill that it'll be determined, I think, by the Social Service Appropriations Committee on a yearly basis. So that cap one year could start at 80,000 people, which would be a good chunk of the gap. But then the next year they could decide that was too expensive and they're going to cut it to 40,000 people and to 20,000. We've seen this happen with the targeted adult expansion. They started out saying it'd cover like 12,000. Now that's down to about 4. So we've seen this. We know where this is going. And then besides the cap, there's work requirements involved in this one. And then even above and beyond all of that. So let's say, all right, they will fully expand. They're going to go to 100%, and the cap is just something that maybe in the future will be an issue. Even then, this is not going to be approved by the federal government. Nothing like this has been approved before. It's kind of like wonky reasoning, but basically, if you only expand to 95% or 100%, the federal government pays a lot more money because the people between 100... We've got our eye on a real bad bill right now. SB 172 is, I think it's Medicaid expansion revisions.
Medicaid waiver.
Medicaid waiver revisions. I get all the names.
I know, all the names are just
They're so close, too.
Yeah.
But it's 172, and basically this is a smorgasbord of bad Medicaid policy. So it would put 5 different waiver requests into a bill that's 3 pages long, not even that.
Wow.
So it would completely remake our entire Medicaid program. It's like 20% of our economy, if not more than that, in Utah, in 2.5 pages of super vague, ill-defined, illegal, untested policy. Things like a work requirement, which I'm sure you guys have talked about before, is solving a problem doesn't exist. 80+% of Medicaid recipients already work or live in a household that's working. If they're not working, they've got little kids, they've got disabled relatives.
There's a reason.
There's good reasons. They're sick themselves.
Right.
So work requirements are terrible policy. Caps are terrible policy. And then this goes a step further. It looks at Oregon as kind of a role model. And Oregon has this system of prioritized benefit lists, where they literally draw a line between which services are covered by Medicaid and which are not. And when it first started, like 20 years ago, they covered almost 600 services. Over time, that line has moved, and so now they only cover about 450. And things that aren't covered are things like NICU services for preterm babies that probably won't make it because they're too little. Things like that are not covered. Cancer care, if your cancer's too far along, they won't cover it because that's a death panel, basically. I mean, you talk about the ACA as a death panel, it's a lot more what this looks like in Oregon. And it's not been good policy over the years. It's been in effect there. It hasn't been implemented by other states because it's not good policy. But Utah's looking at that as the model of what we want to emulate. So this is rationing care, rationing services.
Wow.
It's bad news.
Something that stood out to me when I was briefly looking through this bill was, you and I had talked about it, was what looks like a health savings account kind of for people who are on Medicaid. And nobody's really sure where that money is going to be coming from that goes into that account. Even if it's something where it's the government puts a certain amount of money into the account and then it's expected to be matched, or like a portion of that is expected to be put in by the person who's on Medicaid. I mean, in order to get Medicaid in Utah in the first place, you have to be very low income,
So poor.
and you don't have that money. There's a reason you're applying for
Yeah.
Medicaid, right? So it's to me, something like that really kind of just reeks of like an inability to really understand what's going on with the average constituent who needs this.
It's evidence that you don't know what it's like to be poor, first of all.
Right.
You don't, if you think that people just are deciding not to put money aside because the state isn't matching it, you're not really understanding, because you're not putting money aside because you don't have the money.
Right. I mean, that would be a choice. I mean, that would be a choice for some families between feeding their kids and paying for their bills. That would, I mean, so this is a perfect example. This flu season that we had, my kid ended up in the hospital, my 15-month-old, because of the flu. And we were at primaries, and they were overflowing with kids in the hospital. And so some of those kids, like, what do? Do you decide that you're not going to take your kid whose fever is spiking because you can't feed that child?
Exactly.
It's pretty remarkable.
These are really tough choices that real Utahns are looking at, and bills like this, they're not helping.
Mm-hmm.
It's, this is making it harder to qualify for Medicaid, harder to keep your Medicaid. It's changing this program that so many people rely on because they don't have other options. This isn't a matter of, well, just go get a job. These people are working. They're trying to work. If they could access employer-sponsored healthcare coverage, they would. This isn't an option for this population. So.
Yeah. Catherine, can you tell us, what is Mormon Women for Ethical Government's stance on healthcare? What do you guys talk about? What are you looking at? Are you looking at these bills on the national level? What are you guys about?
Yeah, we are interested in this bill in SB 172 in particular, because we're concerned also about work requirements and the concept of the HSA, which is unclear how that would work exactly. We believe people should have access to health care. Families should have access to health care. And on a state level, we want greater access and more affordable care for people. On a national level, we feel the same way. And we've done a lot of lobbying to try to preserve people's access to care and also, while recognizing that costs are high and that people need to be able to afford the care that is available to them. One of our concerns has been that the costs have gone up across the board for everyone. Employer-sponsored coverage has gone up a lot. Exchanges, it's really expensive there too. So it's a really complicated question, and we're concerned about it as well.
Yeah. I mean, I remember. As the ACA was going into effect, I was really excited because for me and my family, that meant good things. And I was talking with relatives of mine for whom it was a bad thing. This is hurting, the ACA did hurt certain people in the United States. And so we started having a conversation, my relatives and myself, who tend to be more conservative than I am, and we just started having these conversations about what the ACA meant. And we kind of agreed that, across the board, I mean, there's a lot of people who are hurting from this, regardless of the legislation that we've had in place up until this point. Does MWIG have any particular, legislation that, is perfect? I mean, there's no perfect legislation.
Oh, yeah.
But what does perfect healthcare, or as close to perfect as possible healthcare, look like just for Utahns or for you guys in general? I know that's a hard question, and I didn't prepare you for it, so if you don't have an answer, I know.
That is an impossible question,
Yeah.
and I wish I had an answer for that. One thing that we've really focused on, though, is access to healthcare for particularly rural people or people who need a general practitioner, or where areas in which there's not a lot of incentive for physicians to maybe go to a rural area or to practice family practice or general medicine, because it's just really hard for them to repay student loans and the extreme cost of that. So there really isn't one perfect way that we can see healthcare working.
I know it's a hard question.
It is a super hard question. Well, I should ask you instead.
Oh, I'm about Medicare for all. Me personally, that's my love. But I have, I mean, we've all seen, you know, so my sister-in-law passed away from cancer a couple of years ago, and she fought cancer for 5 years. So she was 27 when she passed. And it was very aggressive Ewing sarcoma, so it's a very aggressive bone cancer. And to see, so my husband and my father-in-law share a name, and one day my husband got my father-in-law's hospital bill for his sister's hospitalization for like a 3-day thing. I mean, it was $30,000. I mean, it was insane, the amount of money that we're paying. So, for me personally, again, not necessarily ABU, but for me personally, I always start from like a patient first.
Yes.
You know, and what do we do to make, you know, to help those patients, or even like, you know, my son's 12-hour visit to the hospital. I'm still waiting for that bill. So, and I'm insured, you know, we're insured. So, you know, starting from a patient first perspective and, you know, understanding what it's like to be terrified,
Yes.
whether or not you can pay your bills, whether or not you can pay for your family. I mean, you know, it changes when you have kids, you know, and all of a sudden it's not just you, like, okay, I could go hungry if I really needed to, but you can't do that to your kids.
Right.
You know, so I mean, it's just terrible, terrible, awful, heartbreaking decisions that people are having to make because of healthcare. And when, I mean, we're looking at buying a house, and the people who are looking at our credit, they're like, don't worry about medical debt. Everybody has it. They don't even, you know. But it's insane that that's even the case.
Exactly.
You know?
And I really take the perspective of that if we look at, you know, people that need healthcare the most, those who might be poor, those who are the sickest, I mean, if we want to take the perspective of like elevating those most affected, looking at those who need it the most, we look at something called social determinants of health too, where it's like, where you live affects your health. If you have access to transportation to get to and from a doctor, that affects your health. Your employment affects your health. The environment you live in and the air you breathe affects your health. The housing that you have, all of that interplays. And if you can look at those that have all of these different determinants piling on hardships, and if you can look at that high utilizer that uses a lot of healthcare, spends a lot of money in the system, and if you can help them, then you're going to help the middle class, white, healthy guy that has everything in his favor. Because if you pull up the guy on the bottom that's really hurting, that ripple effect is going to be felt by those that have more privilege.
Yeah.
And so I really believe that, you know, if we can target those that need it the most, that's where we start to really make the biggest impact. And something like Medicaid expansion starts to address that.
Yeah, absolutely. And, you know, I mean, speaking again to your point about the rural areas, I know that we are kind of undergoing an issue right now in the country. I don't know if it's affecting Utah as directly, but we're experiencing hospital closures in more rural areas, and that's a real concern. That I don't know that, I mean, maybe people are talking about it a lot. It's not a thing that I've heard brought up a lot in the healthcare conversation. So I think that's totally right there. And I don't know what it's doing in Utah. Do you guys know?
I don't know specifically. I know that, you know, we rely a lot on community health centers for our rural areas, and those just went unfunded for like 135 days. So, you know, for as much as conservatives like to focus on the white rural voters and pretend that they care about the rural areas, they sure don't demonstrate it when it comes to funding CHIP and community health centers that disproportionately benefit those rural voters.
Yeah. Oh, yeah, and CHIP. Luckily, we just got that funded too. Yeah, and I'm sure.
Thing.
Yeah, were you guys? I'm sure you guys had a thing.
Yeah, we were very interested in CHIP because we all benefit from healthy children in our communities. It's very hard to argue that you shouldn't have adequate health care for children. And their parents, of course, need health care as well. So,
right.
Yes.
Part of that ripple effect, right? If you insure the parents, you insure the kids, and vice versa.
Yeah. So, are you guys following anything else in particular, or is that really what you're like for today? I mean, it changes. Hour to hour.
There is a lot. I am keeping an eye on all the mental health and suicide prevention stuff. That's something that I wish I had more time to like really dig deep into, but something that UHPP is definitely starting to pay more attention to is the youth suicide rate and the suicide rate in general, and ways that we can address mental health and that issue. And there's a lot of bills looking at that. So we're keeping an eye on those, but have to put our focus on saving Medicaid too. So it's kind of balancing all those legislative things. But, you know, all the different Medicaid bills, the substance use stuff, mental health, anything healthcare related, we've got our hands on it. So
Good. So we're going to kind of do a little bit of a pivot now, and we're going to talk a little bit about MWEG. and Mormon Women for Ethical Government. So thank you, and please feel free to keep jumping in. Do you need to leave, or are you good? Okay, that's fine. She has to host a healthcare roundtable. Go talk about healthcare some more. Thanks for being here. All right, so Catherine, so you guys formed, you said last year, right before Trump was sworn in as the president, right?
Yes.
So what was the thought process behind kind of the founding members doing this? It was just a desire to be more civically engaged? Was it in response to kind of an increase in talking about kind of harassment in the workplace, harassment from Trump? Was that involved at all, or was it just, what was it?
Yeah, it was very much about the demonstrated unethical behavior of individuals, of a person. That someone could be, and that we have leadership in our country in various positions that do things that are clearly unethical. Their personal behavior and the behavior that they, the work that they do is also often not following morals and ethics.
Right, it's not very much in line with the LDS values.
Yes, very much out of line with LDS values, yes.
Right.
And you're live.
Hey guys, hi. We had another battery died. So we're back with MY Catherine from Mormon Women for Ethical Government. Anyway, we were saying Mia Love. So you guys want to praise people when you feel praise is due. So
yes.
What about Mia Love makes you think that what has she done that you guys want to praise?
Well, particularly in the discussion of gun control and gun issues, people tend to go to their corner and snarl at each other from those perspectives.
And go.
Okay, so you guys are developing a relationship with her office, and what other issues are you guys kind of trying to talk with her on? So immigration. Gun legislation. Yes. What else?
So far, are we specifically talking about immigration since that's such a critical time with DACA ending next week and TPS recipients losing their protections as well. So those are the main. We've also been discussing healthcare with her earlier this year. So those have been the main things that constituents have been meeting with her aides about.
Okay,
and
cool.
dropping off materials and having discussions.
Yeah. And have you been received well?
Yes. Now I'm not her constituent, so I've never been to her office, but I've been to my representative's office and also to our senator's offices, and we have been received well, really politely, and they've accepted our materials and are interested in engaging in conversation with us.
That's great. So do you have any concerns, still speaking about Mia Love just because it's on my mind, she's my representative, and a concern of mine personally is her lack of accessibility. So I've been to her office many times, and I'm curious what your guys' feelings are on the fact, like, for example, that she has yet to hold a town hall in like the past 2 years, or like a year and a half, or whatever it is. Is there concern at all on your part about the accessibility? Or do you feel, because I know that she's cited worries about threat to her safety, are those conversations you guys have had with her at all?
Not that I know of, no, but it is really obvious the difference in accessibility of the congressional delegation from Utah. You can even from the special election results with John Curtis, who is my representative in the 2nd district, the accessibility that he has versus what Jason Chaffetz had is just very different. So, yeah, there is a big difference. We haven't really had any conversations about whether that is something we are deeply concerned about. I guess we feel like being able to meet with a specific aide who has responsibility for a particular issue or topic is a good way to maybe make our views known, because that is then passed on to her.
Right.
And I think knowing who those specific aides are, having the knowledge that we're learning. We're such a new organization that we have so much to learn. But finding out who's the right person to talk to about this. Certainly, it would be better to at least have some access to her specifically, but at least being able to talk to the right aide is a step in the right direction. And
I mean, John Curtis is pretty good.
Yes.
He's been great. I mean,
Many
holding
town
like
halls.
town hall
Yes.
blitzes, which is
Yeah.
just amazing, and I
Yeah.
love it. He seems very receptive to conversation and to interaction, which is
Yes.
just great. Yeah. So then let me follow up. Let's just kind of end. I want to have a conversation quickly about Utah County Commissioner Greg Graves. Are you from Utah County?
I am, yes.
So you've kind of been following the story with County Commissioner Greg Graves. So to just give a brief background for those of you who are watching, County Commissioner Greg Graves was found in December. He was accused of harassment in the workplace. And the accusations are, you can go and just do a quick search and you can find exactly what he was accused of. So there was an official report done, and the report said that there were, I think it was 14 people who were willing to speak and say that Commissioner Graves does display harassing. He does harass in the workforce, in the workplace, and he also is, the person who did the report said that they think he is guilty of bullying in the workplace as well. So the thing is, it's an elected position, which means in Utah we have no means to remove him from office. There's no recall elections, anything like that, and he has refused to step down in spite of numerous constituents asking him to step down. I believe that there's like 17 members of his own party who are elected officials who have asked him to step down. People in both of his fellow county commissioners have asked him to step down. And beyond censuring, there's not much that we can do. And we at ABU got an anonymous email a couple of weeks ago telling us that Greg Graves is actually back at work as if nothing has happened. And so what is happening now is we are paying a salary of something like upwards of $160,000 a year to someone who, I mean, it's essentially taxpayer-funded harassment in the workplace. And so just you as a member, as a constituent of his, and you as somebody who is in Utah County, and a woman, and you have kids, what are your guys' thoughts on that situation?
It's really a situation that shouldn't continue. But it's interesting that the other commissioners have talked about how they would try to remove him from office, and they have censured him. But yeah, there hasn't been any movement on it. It's really distressing. Yeah.
Have you guys talked about exactly what can be done? I mean, from my point of view, it seems like we need to continue to have this conversation. I mean, so he's in office until the end of this year. So is this a conversation that we can keep on having, keep bringing it to the public's attention? I mean, when we were down there delivering our petition asking for him to resign, and it was signed by over 300 people who lived in his area in Utah County, we were approached by someone down there who, of course, asked to not be named, and they said they were very grateful that we were there and that we were bringing attention to this issue because it was a difficult place to be down there, and with him in the building, with him kind of flying off the handle. And so it's a big concern that